All right, so one more minute and we go. I guess we have quite a number of people already. So we start at exactly 5:05. Thank you so much for joining early. Like I stated earlier, it's very, very professional that we have people join early. It's one of the attributes of a vet. You have to be very, very time conscious. It's teaching time, says 9. Yeah, so in a minute we'll dive straight into it so that we can have enough time. Last month we didn't have enough time to enjoy our guests, but we will this time around. All right, so it's exactly 5:05, and I want to specially welcome every one of us to this edition of the Vet Konect Afrivet Chronicles. It's it's a continuum. It's not supposed to be something that we'll just enjoy last month and forget about it. It's something that we'll continue to enjoy for a very long time. Courtesy Vet Connect. So I want to especially welcome everybody, depending on where we are joining from. Good morning, good afternoon, good evening, colleagues, partners, friends of veterinary medicine across Africa. I want to welcome us this evening on behalf of Vet Connect, the Vet Connect team. It gives me a great honor and joy that we are having this second edition of Nichols. I am Dr. Abiodun, and I serve as the Chief Operations Officer, Vet Connect. Today, we are going to continue a journey that we started last month, being the first edition, a journey of conversation, a journey of collaboration, a journey of collective action. And our vision is very, very simple, but it is urgent. We want to create a vibrant Pan-African platform, where veterinarians, veterinary professionals, where livestock farmers, policymakers, stakeholders,
Okay, I think we just lost Dr. Abiodun and he'll be joining back very shortly. Just briefly to introduce myself, my name is Titilayo Ayedele. A veterinary student, a recent graduate, and I will be co-moderating this session with Dr. Abiodun while we are waiting for him to get his network back. I'd love to welcome everybody joining in, depending on the parts of Africa you're joining. Good evening, good afternoon, and I hope you're having a wonderful time. And welcome to the second edition of the Afrivet Chronicles by Vet Connect. So you've heard a lot of from the introduction from Dr. Abiodun on the very first chapter, which was very amazing, was innovative, getting to learn about the veterinary profession in different countries. So last session we had Nigeria, we had Kenya, we had Nigeria and we had Kenya, we had I see every good big countries. But this time around, we are going to be having um, Cameroon, Rwanda, and South Africa. So I hope you are excited about this. And yes, I think Dr. Abiodun just joined back again.
yeah, sorry about that. I think I lost signal for a bit. Titi, are you with me?
Yes, I am.
Okay, all right. Thank you. I'm sorry about that, please. So, our goal is to shape the future of animal health, not just in Nigeria, but, in Africa at large, as a continent. And this year's theme it is both timely and it is very critical. Our theme this month is strengthening animal health systems for Africa's food security. And we all know that across Africa, the demand we have for a very safe, affordable, and sustainable animal source of food is on the rise. Yet, we cannot boast of a very strong food security. And that cannot even be achieved without, a very good animal health care system. Every outbreak that we prevent, every innovation we adopt, every veterinary professional that we empower must directly translate to a healthier animal, livestock, and that must translate to a stronger economy, nourished community. So we are especially privileged in this month's edition to be joined by three dynamic countries. We have South Africa, Rwanda, Cameroon, who will be weighing their opinions, and their opinions are very vital to this conversation. So each of them will be bringing unique perspectives from, their structured animal health framework to the growing investments in Rwanda, especially in livestock, to Cameroon's resilience in navigating animal health challenges, amidst diverse farming communities. So they are all going to reflect that diversity and strength of Africa's veterinary ecosystem. So I will not, say so much. I think our guests are complete. I just want to especially appreciate every of our panelists and our speakers who have set aside time to share their expertise with us this evening. We do not take your commitment for granted. Your insights this evening would not only inform us, but it would also inspire us to take practical steps in our various contexts. So, to our audience, thank you for joining so early. Thank you so much for believing in Vet Connect. I want to say thank you for showing up again. If you were here last month, Afrivet Chronicles is not just another webinar. It's not a regular webinar that you just attend. It is a movement of voices, a movement of solutions. And the richness of today's section will come from your questions, your contributions, your willingness to challenge old patterns and embrace new possibilities. So as we begin to encourage us to think beyond borders, beyond limitations, and beyond today, because the strength of Africa's animal health system will determine the future of Africa's food security, and that future is in our hands. So, ladies and gentlemen, I'm my co-moderator. Once again, welcome to Afrivet Chronicles 2.0. So let's engage, let's collaborate, and let us shape the future of veterinary medicine in Africa together. Thank you very much. Titi, you have the floor.
All right, thank you so much. So thank you so much once again. My name is Titilayo, and you're welcome to the second edition of the Afrivet Chronicles. And quickly, we'll be doing a very brief introduction of our guests, our speakers, who will be on the panel discussion, discussing everything about the veterinary profession in different countries. And as Dr. Abiodun mentioned, we are joined with veterinarians from South Africa, from Cameroon, and also from Rwanda. I'm sure you're excited already. Okay, I will start by
Yeah.
introducing Dr. Nicole, and Dr. Abiodun would continue. All right, so just a very brief to confirm, Dr. Nicole, are you with us? Dr. Nicole?
Yes, I saw her join. I think she is. I think she's with us.
All right,
Let
so
me
I would love to.
confirm.
Okay.
Yes, she is. She's co-host now.
Okay. Yes, Dr. Nicole would love you to kindly switch on your camera. Would like to see you while we introduce you. while we are waiting Dr. Nicole, I'd briefly introduce her. She is a veterinarian from Rwanda who is very passionate about One Health and production. She currently works with the Rwanda Agriculture Board to advocate national insurance scheme through disease management and increase livestock productivity. So we have a veterinarian who's also actively involved in policy making. So yeah, this is a very going to be a very great panel discussion. I think so, Dr. Abiod.
Yes, it will. Dr. Nicole, can you just say hi?
Hello, how are you? I'm glad to
We're
be here. Sorry
fine.
for the. Hello, are you all listening to me?
Yes, we can hear you
Hello.
clearly. We can hear you
Yes.
clearly, Dr. Nicole.
Okay, thank you. My name is Nicole Goga. I'm from Rwanda. I'm a veterinarian. I currently work at Rwanda Agriculture Board, and I'm happy and very interested to be here. Thank you. Hello, everyone. Salifu Jacob Titialano Abiodun. I'm not well at speaking
You did well. You tried.
those names, but I'm saying hello. Hello to everyone, and I'm glad to be here
Yeah.
with you. Thank you.
Thank, thank you very much, Dr. Nicole. So I will briefly introduce Dr. Ashumbi Alvin. Dr. Alvin Tanyi is a doctor of veterinary medicine, animal husbandry specialist. He's also the regional coordinator for management after sales for Littoral and Southwest region of Cameroon for NJS Group, and is also a One Health advocate. It's a very big privilege to have Dr. Alvin with us this evening. Dr. Alvin, can you say hi to our guests, our audience?
Hello, good evening to everybody. Dr. Alvin here. Thank you very much for that introduction. It's actually a great privilege to be here to share ideas with vets in Africa, upcoming vets in the continent, together putting our heads together to try to see how to make things work better for us and to share ideas from our various countries. They always say learning never ends. And, we learn every day to implement. Every day that we lose without learning, that means we have lost that day. So I
Yeah.
plead it should be an open conversation, ideas from everywhere, coordinated ideas, and together let's all grow to be better people. Thank you very much.
Yes, thank you very much, Dr. Alvin. And hopefully we'll still have our last guest join us, Dr. Nandifa Toyota Ondudane. She's a and leader who recently concluded her term as the president of the South African Veterinary Council. She has successfully advocated for veterinarians and veterinary nurses to be included on the critical skills list and represent Africa on the World Veterinary Association. Currently, Dr. Ondudane serves as principal of the Tsolo Agriculture and Rural Development Institute, leveraging our expertise in agricultural education and policy development. Our leadership and achievements have made a significant impact in the veterinary field. For one very unavoidable reason, she's not here yet, but we are hopeful that we are still going to have her join us today. So welcome. We are so happy to have you, Dr. Nicole and Dr. Alvin. And we are going to go straight into the panelist section. But before that, we would like to know our guests. You can please kindly introduce yourself in the chat box, just your name, where you are joining us from. We just want to know you. We just want to get to, meet new friends. So for instance, if I'm typing, I would say I'm Dr. Abiodun, a veterinarian from Nigeria, and that's it. So if you can, please do that as we as we continue in today's program. So, Titi, I guess we can move into the panelist section, but before then, you can just brief the audience how it's going to go, and we can dive straight into it. Thank you.
Okay, thank you so much, Dr. Abiodun, and welcome everyone. I can see Dr. Bulus from Nigeria, and thank you everyone for introducing yourself. We all want to meet you, want to know where you are from. And as we start the panel discussion, it's going to be very entertaining. I mean, not just entertaining, very participatory. You get to be a part of it. So we are asking our guests questions and they get to answer. And then we would have a session where we want to hear from the participants also. So you get the opportunity to ask questions also to the guests. So I know you're ready. I mean, you have your pens, your books ready to jot some keynotes, and then you're also inviting your friends to be a part of this. Send the link to them. So I mean, this is going to be very interesting. So I would love to start with Dr. Nicole. We'll be starting the panel discussion, and the theme for this second session is strengthening animal health systems for Africans' food security. As we all know, veterinarians play a very key and important role in food security. And so our guests here will be sharing their opinions, sharing the views about veterinarians and food security in their various countries. So I'll be starting with Dr. Nicole, who will be taking the first question, and then when she's done, she calls Dr. Ashumbi to also answer. Dr. Nicole, are you with us, ma'am?
Hello.
All right, Dr. Nicole.
Yes, I'm
Yes.
ready.
Yeah, I can hear you. I can
Yes,
hear you
I'm
very well.
yeah. Okay.
Okay. Okay, thank you so much. So, Dr. Nicole, the very first question on our list here is how critical is animal health to Africans' food security? And why do you think it's often overlooked in national food policy? I mean, in your country's context, do you think that the animal health is critical to Africans' food security? And do you think it's often overlooked in the national policies in your country, Rwanda?
Okay, thank you. I'm going to say from my country how the status of it. Um, for us in our country, especially of Rwanda Agriculture Board, um, animal health, we take it as the critical point for improving food security, where um, there is associations of students who have graduated from vet medicine, animal production, who just go and join, and even the Association of Veterinary Doctors. There are many. There are, like I can say, they are cooperative, or they are the groups where in one district, different district have um, what we can call the veterinary sanitary mandate, where they are implementers of animal health. They look on things to like in insurance, we need to improve the product. In a disease come suddenly and take the animal's life, and when we have seen that it's declining both the economy, the people's, most of our peoples are in agriculture, So we have seen it as one strategy to improve the food security in our country, and it's I can say it's one of the critical point in everyone, or recommending to anyone to just take it as the critical point to improve the agriculture productivity. Yeah, thank you.
All right, thank you so much, Dr. Nicole, for that answer and sharing your own insights from Rwanda. So I would also love to hear from Dr. Alvin. What is your opinion about animal health, food security, and do you think the national policies in Cameroon, do you think it's overlooking this aspect?
Okay, thank you very much. Thank you very much, and special thanks to Dr. Nicole for her insights. Animal health and food security, like, there's this saying that one of our anatomy teachers back in school always told us: a medical doctor treats humans, but a veterinary doctor treats humanity. And for us as vets, it's our responsibility to know that food security, we are all called upon in the domain of food security, because everything that we do, it's like a circle. It's like a circle. If we neglect our own aspects as vets, it affects human health in our various countries. And that's why in my country, like in Cameroon, the government is actually doing a lot, a lot to make sure that food of animal origin is actually very safe. Even apart from that, also pets around, like we have this free rabies vaccination every September for rodents, for animals, dogs, cats, monkeys, and all that. All these are aimed at reducing cases of rabies in the country. Also, there have been a lot of work, a lot of research, which is also done on food animals, and also with all the controls that are done in the slaughter slabs to make sure that the meat which goes for consumption, for human consumption, is actually very much wholesome. Yeah, because we cannot be having meat leaving the slaughterhouse with which is disease infected, especially zoonotic diseases, which will later on be seen in the population. And also, it's always a very difficult fight, because a lot of people still look at veterinary medicines like animal medicines. A lot of people have not really understood that it's a vital role in our human existence. That's why we always sing about One Health, because all coexist: humans, environment, animals. If we neglect any of this, that means the rest will be in a very, 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 very big mess. So it's very important for us to look at this critically, not just looking at it with a light eye, but look at it yeah, in a very critical point. And I really wish that we all should take it as a personal fight in our various places. Yeah, you cannot change everybody, but you can change somebody. You can talk to somebody who will talk to somebody who will talk to somebody. Thank you.
Thank you very much, Dr. Alvin, for that. I mean, it's so nice to see your parts coming from not just the national policies, even up to every individual. Like you have the knowledge, then you talk to somebody, then you talk to somebody, and then they are aware and seeing like the efforts of the Cameroonian government to ensure food security, which is very commendable. So I will be handing over to Dr. Abiodun, who will be asking the next question.
Yes, thank you very much, Dr. Nicole and Dr. Ashumbi, for that very concise and interesting response. So I'll be asking Dr. Alvin now. In Cameroon, what are the weak animal health, system? What is that particular uh, what is that particular link in your animal health system in Cameroon? Or let me rephrase, in your country in Cameroon, what are the weakest links in the animal health system that directly affect food production? I don't know if that question is understood, Dr. Alvin.
Okay, if I get you well, you're asking for the weakest links that, please just rephrase again so that I can get it very well,
Yes,
please.
the weakest link in Cameroon's animal health system that affects food production is at the at the farmer level. Is it at the livestock farmer level? Is it at the veterinary level? Is it at the inspection? Is it at the marketing? Is it at the end user? Where in the food chain, when it comes to animal health, do you have the weakest link?
Okay, thank you very much. Well, the weakest link in Cameroon, it comes mainly from the farmers level. Well, and
Okay.
honestly, I will not actually blame them totally, because I believe also us as veterinarians, we have not also succeeded to adequately communicate, especially when it comes to animal health. And also, I also will come in with some, because there's a certain level of, ignorance. Let me just take an example, right? When I was doing my final year thesis, which was on seroprevalence of leptospirosis infections in cattle slaughtered for human consumption, I was shocked that many people did not even know that a disease called leptospirosis existed. And the way butchers were handling the meats at the slaughterhouses were just that they actually exposed themselves a lot to these diseases. No personal protective equipment for themselves, and we all know that leptospirosis is transmitted through body fluids, blood, saliva, and all that. That means they were so susceptible to having this disease, and the results were shocking, because I had over a 66% prevalence, which is very high. So I think that, in Cameroon being in an African setting, there is a lot of work when it comes to communication of these various animal or zoonotic diseases, yes, which also affects the animal production. I'll go into pigs now, where, in the rainy seasons, we have African swine fever, which always hits a lot of farmers. Last month, I was confronted with a farmer who lost all of her animals because of African swine fever. And I think that, to an extent, if we had communicated the uses of biosecurity in farms, we will not have situations like this. But now, on our part, what are we doing? We have to get into a lot of sensitizations, telling the people, when people know about something, they'll easily know how to, prevent against it. And I think that's also one of the things that our government is trying to emphasize, laying emphasis on seminars, teachings, because it's not only an affair of farmers, it's an affair of we all. Yes, because I like to put we all, because if the farmers are affected, they will not produce enough that we all will eat. So we have to help the farmers to also enhance and increase their production, and also reduce their cost of production. In what way? by preventing diseases which will entail a lot of expenditures in terms of antibiotics, and also prevent the abusive use of antibiotics for no reason. Because I always tell people the best way, especially when it comes to animal husbandry, biosecurity is key. With biosecurity, good hygiene, which is not natural hygiene, you can save yourself a lot of problems, and you can also save the population from a lot of zoonotic diseases. So I like going back to your original question, which is the weakest link. The weakest link is from the farmer's part, but I also know that it's also lack of appropriate communications that we also get the weakest link from there. And as of now, the government is trying its best to communicate a lot, and a lot on animal health in general and on One Health as a whole. Thank you.
Yeah, to the farmers. Yeah, thank you so much. Thank you so much, Dr. Alvin. Dr. Nicole, which is the weakest link in the animal health system in Rwanda?
Sorry, I didn't get the question well. Please come again.
Yeah, the weakest link in the animal health system that affects food production in Rwanda. Is it from the livestock farmers, the breeders, down to the veterinarians or the transporters or the inspectors, meat inspector, or the end consumers? Where do you think you have the weakest link in Rwanda?
Okay. The weakness in
Are you there, Dr. Nicole? Dr. Nicole. Okay, I guess probably our network signal there is not so strong. All right. Titi, we can move on.
All right, thank you very much. So while we are waiting for Dr. Nicole, I think we'll have to go back to Dr. Alvin. All right, Dr. Nicole is back. So Dr. Nicole, are you answering the question now? Dr. Nicole? Okay, so I think she has a little bit of network issue. So while we are waiting for her to get back, we will be moving with Dr. Alvin. So, Dr. Alvin, thank you for the insightful answers so far. And we'll move to the next question, which is with smallholder farmers and the veterinarians. So we know it's very important that farmers also get veterinary services. So in your country, is there a bridge between smallholder farmers and veterinary services? And if there is a gap, if there is this bridge that is causing this gap, how do you think that this gap can be closed?
Okay, please, could you take the question again? I did not really get you very well. Sorry.
Okay, yes. So the question is there a gap in Cameroon between smallholder farmers and veterinary service, like smallholder farmers receiving adequate veterinary services in their farms? And if yes, if you have this gap, how do you think that this gap can be closed? Or if you do not have this gap, you mean you have small farmers having adequate veterinary services, what can be your suggestion to other veterinarians from other countries? Like, how can we ensure that there is a continuous bridge between the smallholder farmers and adequate veterinary services?
Okay, very, 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 very important question there. Well, in Cameroon, I would say that there's not such a great gap between small animal farmers and veterinary services because almost everybody who is engaged in livestock farming is registered with the Ministry of Livestock Services in that locality. And also, apart from that, in the various private companies that we have, which deals with maybe, let me say, pig, chickens, and all that, there is management after sales, and which this management after sales is run by either veterinary technicians, veterinary nurses, which are all washed over by a vet doctor. So that gives some kind of a watch over all livestock production which is going on. Yes, there are some cases where we have, should I call them charlatans? I don't know. These people who believe that they have been in the field for a long time, but they are not vets. And this is, I think, the most difficult scenario that we are dealing with because they are the people which are really responsible for the misuse of antibiotics. That's why we have a lot of resistance now. So majority of our fights now is to fight against the misuse of antibiotics, to fight against antibiotic resistance, which is becoming a national worry and also a global worry, as we all know. And also, like I said earlier, for those that I've worked with, I have a simple principle: biosecurity, because I consider all animals like small human beings. If you keep them in a good hygienic environment, they will not get sick. And if they don't get sick, it will also help your pockets because your pockets will not bleed for the buying of antibiotics. And if your pockets don't bleed for buying of antibiotics, you sell your animals and you make more profit. And at the end of the day, you will be happy, your family will be happy, and you want to produce more for the population. And in turn the environment will be happy because there has been no misuse of antibiotics which will pollute the environment. Yeah, it's true that some might not buy my idea because pharmacy too, it's also one domain that gives a lot of money. Yeah, let's not also forget about that. But we have to always look at the truth how it is, face the truth how it is, and accept things for how it is. So there's no really a big gap between small farmers and veterinary services because at every farm you get to, you actually see it registered under a veterinarian, which is a good thing, and it gives a certain level of control over these farms and control over disease outbreaks, which we might experience sometime from now and then. Thank you.
Thank you very much for that insightful response. And yeah, it's good to know that small farmers in Cameroon have access to quality veterinary services. Just like, what advice would you want to give to countries like, say, Nigeria? We have situations where some small farmers do not even know, like, they need to take their animals to a veterinarian in some very primitive places. So, like, what kind of advice would you give, like, to countries to ensure that even the small scale farmers have access to quality veterinary services? What has really worked for Cameroon?
Okay, in terms of veterinary services, I think Nigeria is a little bit ahead of us. But I have always grown up with this notion of communication is key. You can't, people can't do what they don't know about. And I think sensitization should be one of the highest tools that has to be used to actually get people to know that they actually have to take their pets or their animals. It has to be followed by a veterinarian who understands how uh, diseases of animal origin works. It will shock you to know that there are some people who go as far as owning dogs and they don't even know that they have to vaccinate them. And you know that it's very risky because a dog alone can give you leptospirosis, a dog alone can give you rabies, and a lot more, you see. And you cannot really blame these people because they have not really had the idea that dogs too need to be protected. And when you protect your dog, you're indirectly protecting yourself and your immediate environment. Just like many people don't know that Newcastle disease in poultry is a zoonotic disease. Yeah, a lot of people don't know about that. It's true that it's not a very serious zoonotic disease, but it is a zoonotic disease. And I think that if we keep neglecting it because of ignorance, in some 10 years to come, it's going to be a call for concern that Newcastle disease will become a serious zoonotic disease because, like we all know, our viruses mutate. So all I would say is that adequate communication, sensitization, seminars, and there should be an intense field work where the veterinarians of the country take it upon themselves to go down to the field. They should go down, try to discover. They should do some, let me say, free work. Because one thing I realize is that even in my country, many people don't want to do free work. And it's only through this free work that people can benefit, can learn more. And it's also through this free work that people can really know what veterinarians are all about. So we need to invest more in this to get people to know about veterinarians and know the importance of their role in their animal farms, in their pets, and in One Health as a whole. That's what I think. Thank you very much.
Thank you very much, Dr. Alvin, for that response. Like what we get here is communication is very important. Like communicating even to the grassroots, so everybody is aware of the importance. All right, so I will be handing over to Dr. Abiodun.
Yeah, I think Dr. Nicole is back. If she can answer, if she has a response to that. Dr. Nicole? Dr. Nicole, are you back? Are you there? Okay. All right. I guess we would have to continue. Yeah, so thank you once again, Dr. Halvin. Let's talk about technology and innovation. I mean, this is Vet Connect. I'm hosting also. We'll start with that. And how do you think technology, probably apps like Vet Connect or any other disease surveillance tools or AI can, you know, can be leveraged to improve early detection and rapid response to animal disease in your country? Is there any innovation or technology you are using, and how has it helped in early detection of diseases and rapid response? Oh,
I did not get you very well. Could you please rephrase again? Thank you.
yes, Dr. Alvin, is there any innovation or any technology you are using in Cameroon that helps you in probably disease surveillance or treating animal disease. Like in Nigeria now, we have Vet Connect. With Vet Connect, you can download, the app from Play Store or Apple Store or through your website. Then you can reach a vet. You can reach a vet. You can predict diseases by just imputing clinical signs. You can also impute your medical record. So is there any app like that, or is there any technology at all that you are using in Cameroon as a vet, contributing to the animal health system?
Um, yes, there is one per se, but I will not really say that. I will not really put it in front because they are still working on it, right, to make it perfect. But they are rapid disease detections that are being done to also ease treatments, because you know that in the veterinary field, majority of animal diseases have the same signs and symptoms. So it actually needs you to sit and do some laboratory tests to actually be sure of your diagnosis. So, well, I won't say there is anyone for now in Cameroon, but there is some work being done with respect to that domain.
Okay, all right, thank you. I guess we have to bring one to Cameroon ASAP. Dr. Nicole, are you there? All right. Okay, I think she just got back. Dr. Nicole, welcome back. All right. I guess I'm going to hand over back to Titi uh, while we wait. Titi, you have the floor, please.
Yes, thank you very much. Dr. Nicole, can you hear us now? Okay, so while we are waiting for Dr. Nicole, we'd love to hear from the participants, from the audience. We'd also want to hear also from you. So we'll be taking a very, very short diversion to the audience part. And we'd love to ask, I mean, if you want to answer a question, you can just use the raise hand filter and then you'd be able to share your opinion. So there's this engagement question on what do you think veterinary medicine in Africa would look like in 2035? What is your vision for veterinary medicine in Africa in 2025? So if you love to answer, you can just use the raise hand um feature and then you would be able to unmute yourself. This is for somebody, anybody, come on, just don't be shy. Okay, I think we have Dr. Nicole back. All right, while waiting for someone from the audience to share their opinion about how you envision veterinary medicine in 2035, I'd love to ask the CEO of Vet Konect, Dr. Teresa Sa. So what do you think? How do you envision veterinary medicine in Africa in 2035?
Okay, hi. Can you hear me, Ayo?
Yes, yes, we can hear you, sir.
Okay, well, first, wonderful conversation. I'm truly enjoying myself here, listening to all of the insights that are coming in from our colleagues across Rwanda and also Cameroon. So just to share my 2 cents on the question of how I look at it, I think we need to ask ourselves first and foremost that if we continue with things the way they are, will we even get to a 2035 to even talk about? And, the system currently has a lot of challenges, but it's really in the midst of these challenges that so many engineers and forward-thinking young vets, older vets are saying we must take our destiny into our hands. So my thinking is, if we stay on this path of saying, let us correct the challenges around information access, or let us correct the challenges, and this is something that Dr. Alvin has already, spoken very loudly to. Let us correct the challenges around, quackery. We in Nigeria will regard it as quackery. Where non-professionals are making a mess of the system. If we continue to ensure that government on its part strengthens our systems with the right infrastructure to improve on diagnostic processes, then I believe that at that 2035 that we're envisioning would have been in an ecosystem where we are cohabiting properly with our animals and our world is safer. The scourge of antimicrobial resistance would have dropped drastically. Zoonotic diseases would have, in terms of incidence, would have dropped drastically if we continue on the path of driving positive innovations regardless of the challenges that currently impact us. So that is, for me, what I think would happen by 2035 if we stay on course in doing the bit. And I will say again that I'm so excited about learning to realize that there's a practice in Cameroon that ensures that if you want to set up a farm, you register with the veterinary authorities. I think it's a lesson we can also draw from here. We move around, a lot of farms are littered all over the place, some large, some medium scale, some small scale. And for them, some might even think, well, bringing on a vet or even putting that knowledge out there is a waste of resources. But now I think there's a lesson for us to learn, even in terms of trackability and traceability. So yeah, that was a strong learning point for me that I wanted to take away. Thank you.
Thank you very much, Dr. Teresi, for that wonderful insight and sharing your vision, how you see 2035. So if things continue the way they are, from Dr. Teresi's opinion, we might not even have the 2035. So we need a lot of things to change. And just like Dr. Alvin has mentioned, we need to work on communication. And so we can have a better veterinary profession in Africa in 2035. So is there someone from the audience who would also want to share their own little sense before we call on the guest again? Anybody? Don't be shy. Just your opinion. How do you see veterinary medicine? How do you see the people, the animals, the environment in 2035? Okay, I think some people want to take some time to think about it. So while we are waiting for the guests to think about it, I think we can quickly go back to the panel discussion, and I'll be handing over to Dr. Abiodun now.
Okay, Dr. Titi, I didn't expect you to still hand over to me again, but I will just take a question before you round off. Okay, let's talk about, since we are talking about the future, let's talk about sustainability. Let's talk about, Africa veterinary medicine. So, Dr. Nicole, what are the top 3 priorities that you think that Africa must address in the next 5 years to build that animal healthcare system that guarantees food security? Dr. Nicole, are you there? Okay, Dr. Halvin, are you there?
Yes, I'm here. I didn't get your question. Well, could you please rephrase? Thank you.
Yeah, I said, what are the 3 top priorities? What do you think Africa should prioritize? The top 3 things Africa should prioritize in the next 5 years. to
Yes.
achieve that resilient, animal healthcare system that we've been craving for, especially as it links to food security.
Okay, as it links to food security, what we should
Yes.
prioritize.
Yes, three things that you think we should prioritize as Africa, as a continent.
Okay, for me, like I've been singing ever since I started, the first thing will be communication. Appropriate communication, and the stakeholders who are in the domain should really take things seriously. Appropriate communication on animal production first as a whole, and animal health, and more sensitization on one health is one of the most important points that I think we need to prioritize. And the second point, I think we should be looking at the next generation of vets that we are training, because uh, some of us now, the vets which come out from school now, yeah, they want to get money very fast. They want to drive big cars, which is very good, but we forget about the main objective, and the main objective is what you've just asked. How do we look at things in the next 5 years, in 2035? How do we see things? And I think that there was a speaker, Dr. Teresi, who said something very, very important. And I think that if we don't look at things the way he said it, we might not even meet that 2035 the way we want it to be. It's our affair. It's our affair. Animal health, it's our affair. And I think that we have to come together to make it better, and to make animal health systems better come 2035. It's true that I have not answered the question how you want me to answer it, because that's actually a very open question, and very deep. Three things. Which three things can I choose? Well, if there's one thing I should say, it's key. It should be communication, sensitization, communication. Trainings should be multiplied so that people should do things the right way and not the wrong way. Yeah, that's what I would say. Thank you.
Thank you very much, Dr. Alvin, for sharing your own sense on this. Yes, communication is very, very important if we want a better African veterinary service in Africa come the next 10 years, which is also something Dr. Teresi has, emphasized on. So, Dr. Nicole, if you're I'll be told, would love to hear from you. What do you think we can improve in Africa to have a better veterinary profession? All right, so I think Dr. Nicole's service is off while we are waiting. So I think the participants have some time to think about imaginary. Like, how do you imagine veterinary medicine in the next 10 years? So I'm a veterinary student, and in my imagination, how I see veterinary medicine, just like Dr. Alvin, Dr. Teresi has said, if we improve, if we improve in communication, we are working in collaboration and not just working in isolation, and we are open to evolving. There's a lot of innovation everywhere, especially in the Western world. We are open to evolving, bringing this innovation, and not just having these information and keeping it, but also sharing it to the public, that people know the importance of these services. They know the importance of AMR, they know the importance of zoonotic diseases. They don't just hear it, but they actually know what it is. If we also can have collaboration with the government, I see a continent with less talk on AMR. I see a continent where people are more intentional about their animals, about their animal health, about their animal welfare. I see a continent where we have improved food security. So, like, if we can improve on the challenges we have, I see a continent where we'll be doing really great in every aspect of animals, domestic animals, food animals, wildlife. I see continents where we can have better veterinary care in all these areas. So if you're also a veterinary student like me, you can also share your own sense. I mean, it's open to everyone. So if you have something to say, if you are too shy to maybe talk, you can always put it on the chat box. And so while we are waiting for that, I would love to ask them the final question for the panel discussion is to Dr. Alvin while we are waiting for Dr. Nicole to come back. So the question is, how do we ensure veterinary voices are heard in high-level food security and agricultural policy discussions? Most times the people making these policies are not really veterinarians. So how can we be sure that the veterinary voices are heard when these policies are being made?
Okay, thank you very much. Once again, I'll say a very good question. How do we make sure our voices are heard? Majority of the times we are tempted to think that it's only about talking and sensitization that is good, which is very important. But I will also say that sometimes for us to talk more, we should act more, because our actions will always speak louder than our words. We cannot try to change policies or try to be heard where in our actions we don't actually show any change, because it's two things to say something and it's another thing to actually act. So I would say that for us to make our voices heard better, we should, what do we have? What are we bringing? What do we want to change? If we can have something, it's like a son going to ask his father that, okay, dad, I'm going to the university, I need to have a small fridge in my house. Yeah, the father will see it important. Yeah, say, okay, my son, I've heard. But if that same son goes with, let me say, a 15,000 naira or 15,000 francs, that dad, I want to have a fridge in my house. This is what I have in hand. How do you assist me to buy the fridge? You see that at that point in time, the father takes a bigger interest that, wow, he's actually serious about what he's saying, and I'm going to support him. That's just what I'm trying to say. The first thing is that we as veterinarians have to be united. Not only united by profession, but united in our ideas and united in our goals. We have to be able to, because I think that in majority of the African countries, the veterinary councils, I don't know in Nigeria, I don't know how it's in Uganda, but I think that the veterinary councils are not yet as strong as the medical councils. That's why at a certain point in time, in the medical council, because of the way they are strong, their voices are together, they can easily be heard. But we are still trying to gain that, should I say, independence, to gain that feet on the ground. So I think that the first thing that we have to do is that as veterinarians, we have to come together, because I think together we go further. If it's only my idea, if it's only your idea, trust me, we'll go nowhere. But if together we want to make things better and we come together, we sure will move mountains. But first, it should start from our mentalities as individuals, as veterinarians. And from the small individual works that we do in our small corners daily, our actions could even speak louder than any word that will ever bring forth. That's what I think. Thank you.
Thank you very much, Dr. Alvin, for that. That was really, motivating and inspiring to see that we need to work together to make our voices to be heard. Just like an African proverb, you say a stick does not make a broom; it's a bunch of stick that makes the broom. So to have our voices heard in where policy decisions are being taken, we need to work together. We need to be united to have a united force so we can be stronger. Thank you so much, Dr. Alvin, for that. It was really very insightful. Now, back to our audience. I think we've had some time to really think about how we imagine veterinary medicine in the next 10 years. So, quickly, is there anyone that wants to share their own opinion? Anybody? How do you imagine veterinary medicine in the next 10 years? Just something, even if it's just a sentence. Okay, Dr. Terrace.
Yeah, I mean, thank you again so much, Ayo, for the energy that is coming through the room. I think these are conversations that we need to have more at a continental scale. And Dr. Alvin has already emphasized a lot of these points. Individual brilliance will take us so far. It's when we bring it collectively that, that impact that we seek to make would amplify at a larger scale. And he said something really, really important that I also want to re-echo. Talking about the fact that in comparison to our medical colleagues, we are not there at that point of strength yet. And for me, it's not even a numbers thing. If you look at the scales that, or the fate of the world as it were, remember what COVID did to us, how it brought the world to a standstill. I think for once, or maybe in a very long time, suddenly a lot of people paid attention to what it meant to be more conscious around the intersections between animals and humans. So at where we are, and we have highlighted a lot of these challenges, like I said. So we must first start from what is within our control. And as professionals, we are all, trained, we went through a body of knowledge that conferred on us, doctors of veterinary medicine. So we must ask ourselves what role we are going to play in righting the wrongs that currently exist. And there are a lot of them. Perhaps it's in emphasizing the correct practice. Perhaps it's in terms of ensuring that, more persons know better how they are supposed to respond in certain situations, like Doc has already spoken about communication. But more importantly, we must understand that this is not a problem that we'll confront in isolation. Now, let me borrow a leaf from other realities across Africa. When when a problem happens in an African country, sometimes we look at it as if it's, a Nigerian problem, or a South African problem, or a Liberian problem, or a Libya problem. But history has taught us that those things have a way of spilling across board if we do not take a collective stand. Look at the case of Libya. Libya was one of the shining stars across Africa. Gaddafi has fallen, and the rest is history. We see what is happening in even in Cameroon, in other parts of the country. See what is happening with Sudan. So we must also borrow a leaf from there to say that in the animal health ecosystem, where we are, I would say, guardians of the galaxy, if I'll borrow that term, what can we do collectively so that a problem in Cameroon is not regarded as a Cameroon problem, but an African problem? The challenge of antimicrobial resistance alone if you look at the data that the World Health Organization shared, it's accounting for over 700,000 deaths across the continent. That is more than what malaria and HIV are doing currently in deaths. It's not a joke. And sometimes when we throw around these numbers, we make the mistake of just hiding behind the statistics and just making it look like it's just numbers. But these are human faces who went to the hospital, ran tests across several antibiotics, and realized that there's no way forward to treat them because not one antibiotic is responsive to their plight. And a lot of these things are happening because our food chains or our food systems, especially in the livestock space, are very, very broken and non-transparent. So this is me just saying, this was not to answer your question, but this is me just saying that collectively, I think we need to think at that scale. Africa is an irony of a basket of opportunity and also a basket of challenges. So it depends on how we decide to look at it, because on one front, we are about the poorest continent on earth. In another front, we are the youngest. So we now need to decide the spectrum we want to look at things from. So more young people are coming into the veterinary profession. They need to come with a different mindset to understand that these are the challenges confronting us, and we must collectively work as a team across our countries to be able to bring in the kind of result that we seek. And for us at Vet Konekt, that is exactly what we represent. That Pan-African solution that says that animal health care does not start and stop with animals. It borders on the very existence of our human population, whether it's in terms of those who are pet parents or those who are livestock farmers. And maybe to close, Doc said something again around the fact that Newcastle is a zoonotic disease, and how many farmers even know? And yes, it might not be a serious problem now, but who says 5 years from now we'll not be dealing with another pandemic? In Nigeria, we know that poultry is one of the most advanced or most embraced livestock subsectors in the country. So it means that every neighborhood that you check, one in two has a backyard poultry. Imagine if something goes wrong, God forbid, that blows up at a national or continental scale. The odds won't be good for us. So we must take this conversation seriously, and we must embrace this as a Pan-African fight, not just a country thing where everyone should mind their business. These are my thoughts. Thank you.
Thank you so much, Dr. Terrace, for that. Like it's really, really great to see that we should not work in isolation. We work together, whether we like it or not. We are connected somehow. And so not just say, oh, this is that country or that is that country's problem, but see it as our problem, and we should work together. Like Dr. Terrace also emphasized on the power of unity, not just in countries, but as a continent together, so we can have improved veterinary care in our continent. Thank you so much, Dr. Teresa, for that point. It was really, really helpful and insightful. Okay, we have Dr. David who would also want to share their sense. Dr. David, you can unmute yourself.
Can you hear me now?
Yes, yes, we can.
All right. Greetings to every distinguished senior colleague and friends. I think this meeting is timely, and as a matter of fact, virtually everything being said is hitting the nail on the board. Actually, I think I just have two things to say. One, there's a need for us to realize that beyond profession, politics bear rule. And there's a saying that thrones bear rule. We need veterinarians to step into politics to be able to, in a way, effect policies that can transform the veterinary community, because we are limited in number in politics. There's little that we can be able to achieve. But the more we are in politics, we can be able to effect certain things. Like in Nigeria, There are states where young veterinarians in veterinary schools enjoy privileges, and in other states they do not. And this is traceable to the fact that in those states where veterinarians don't enjoy scholarship and support is because veterinarians are not in politics. So we must think politics in order to effect certain things that will benefit us, not only as a profession but also as individuals. I've been privileged to be part of systems, and I see that things don't work because you are entitled. They work because you have the power of lobby. I'm currently the senior special assistant to the governor of Taraba State on animal health, livestock development, and I see that despite the ideas we have on the table, we will not be able to achieve much because the number, of course, even in the business world, population or number has enormous impact in transforming policies that will benefit whatever profession. The human community, the human medical community, has a link in trying to make it look like they do far more than us. But someone that has only an idea of one species cannot compare himself or herself with someone that has diverse knowledge of different species. We must come into politics. Secondly, I wouldn't know if it's a policy or an indoctrination that limits our ability to publicize whatever concerns public health, zoonotic diseases, and what the veterinary community is doing to safeguard human lives. But we need to come into the media, be it the multimedia, the social media, the conventional media. Veterinary medicine must take its place in not only advertising but making it clear that these are the things that we've been able to do. In a debate, I was privileged to be there, and because the numbers were limited, they, the participants tried to convince the audience that human medicine has done far more than any other medicine. But I think it's an aberration of the truth. So we need to begin to think social media. We need to begin to take media in order to reposition the veterinary community as one of the greatest professions that has transformed generations and also timeline. Thank you.
Thank you very much, Dr. David, for that sense. Yes, coming together is one thing, and then being there, having an active voice as a lobbyist is also another thing, so the voice can be actively heard. Oh, see, I think Dr. Alvin, yes, you can share your opinion.
Okay, thank you very much. And I want to say a very big thank you to Dr. David and Dr. Therese because for that good input. In fact, I'm loving this very much. I just want to add that I want us veterinarians to know that actually we have a voice because Dr. David said something important because this doctor of human medicines, they have made us almost feel like we are not useful. But come on, if we don't work against anthrax, if we don't work against bovine tuberculosis, if we don't work against bovine leptospirosis, if we don't work against Ebola, that's the human race is finished. That means we have everything in our hands. We have the power in our hands, my people. The power is in our hands. We have, in fact, in the years to come, vet medicine is going to be at the center of public health because we have a lot of diseases out there which are of animal origin, and this is where vets need to showcase their importance. We don't just have to sit behind and say, well, I take care of animal. Dr. David said it well. Somebody who treats just one species cannot compare with somebody who treats more than 9 species. And truth be told, an animal will never come and tell you that I have a problem in my stomach. No, I have a problem on my head. No, you have to know the animal's normal behavior to know the animal's abnormal behavior. We have to understand that now the fact that you can do a correct diagnosis on an animal is something extraordinary, because the animal tells you nothing, but you just use your knowledge that you've obtained from school to bring out a diagnosis, and from there you put out a very good treatment. I think that it is high time for vets to really stand up, because when you go to Europe, America, if you see how vets are actually treated, how vets are normally included in some of these public health meetings, you enjoy it. But we have decided to take the back seat, which for me it's not normal. We have to really sit, evaluate ourselves. I think it's high time for us to really have that talk on how to carry our vet medicines higher, because now only us fit help us to become us. Thank you.
Thank you so much, Dr. Alvin. I mean, Dr. Alvin had to use the pidgin English to express, his thoughts on this. And even as a veterinary student, to fellow veterinary student, like this is a take home for us. Like as veterinarians, we should be proud. We should be proud of what we are doing. We have a voice, and we should make use, leverage. I mean, the young vets, the Gen Zs, leverage social media to send like proper information about your profession, because your profession is very, very important. So now we have Dr. Nicole back with us. So Dr. Nicole would also love to hear from you. Hi, Dr. Nicole. Dr. Nicole, can you hear me? All right, Dr. Nicole. Yes, thank you very much. So, ma'am, we would love to hear from you to say how we can improve, like ensure that the veterinary voice is heard where policies are made. And seeing you also work with the policy industry in Rwanda. So we want to hear, how do you think as veterinarians, what can we do to make sure our voices are heard to improve policies? Okay, ma'am. So Dr. Nicole needs to be unmuted. Can you try now, ma'am?
Hello, I was stuck. I wasn't able to speak that you can hear me. Hi everyone. I'm glad I'm back. So can you please come again for the question, please?
Okay. So the question is, um, what can veterinarians do to ensure that our voices are properly heard where policies decision are taken? Like, how do you think we can do this to achieve this?
Okay, thank you all. Um, what I think is that we can join our hands on together, because once you want to reach higher or to go far, you just have a plan firstly, and join hands with our colleague. Like this is the best steps of this commitment of Vet Connect, connecting vet together, and from different regions, so that they can build an association or cooperative, because we have broad things, either in humans, animals, production of food. Once we don't join our hands or our ideas together, we can't have something productive, or we can't reach higher. So my suggestion is that we can join together, cooperate together, sharing ideas together. Yeah, thank you. That's my suggestion. Thank you.
Thank you very much, Dr. Nicole. That was very insightful. So, like in general, what we learn is unity. Like from all our guests, we see the emphasis on unity. We have to work together to share our ideas together and not work in isolation. And apart from unity, we also have to have an active representation also, who will be a voice for us where these decisions are being taken. And so we can be properly heard and our information, our ideas can be properly communicated. So I'd like to say a very big thank you to all our guests and all the participants today. Thank you, Dr. Alvin. Thank you so much, Dr. Nicole. Thank you, Dr. David, for also sharing your sense. And thank you to the CEO of Vets Konekt, the person who had the dream, the vision. Thank you so much also for your contribution to this discussion. So quickly, I would love to talk a little bit about Vet Konekt, and I'll once again be inviting the CEO to give us a very brief discussion on Vet Konekt.
Okay, thank you, Titilayo, for the opportunity again. Thank you, Dr. Nicole. Thank you, Dr. Alvin. Wonderful conversations here. And while this conversation is emanating from Nigeria, it's simply a factor from Nigeria to the rest of Africa. The way we look at Vet Konekt is that vehicle through which we want to be able to, in a very foundational way, address the challenges or barriers to access to animal care and social protection for both livestock farmers and pet owners. Like I said, I don't want to just repeat some of the challenges we have already highlighted. Our broad vision is to build this Pan-African platform that serves as a unifying platform, bringing together professionals across the African continent, and from on here, launching out to every nook and cranny of the continent, whether we're doing it virtually or physically, to address the challenges that undermine animal care for our millions and millions of livestock farmers and pet owners. This is a conversation and a vision that we take very dearly because, like I said, it doesn't stop only at the level of the animals, but it also has a very strong bearing on ourselves. And if you would agree with me, any single time a farmer under your watch loses a herd of livestock or its flock or whatever category they fall under, it's not a happy moment because it means the farmer has lost income, and you as a professional will also not be able to go back there to draw income because you have no service to render to such a person. So it's in our interest to ensure that our continent is prosperous. And when you look at the volume of people who are depending directly on livestock production as a means of livelihoods, like I said, it's something that we cannot turn a blind eye to. Now, moving forward, what I see in front of us is this clarion call to say that despite these challenges, what is going to be our approach to solving them? And for us at Vet Konekt, we believe that technology will be that driving force. Technology through mobile connectivity, technology through artificial intelligence, to ensure that, like I said, distance is no longer a barrier. The right information is gotten to the livestock farmers and pet owners, and holistically, we build a more resilient ecosystem for ourselves. So currently, the Vet Konekt platform ensures that animal owners are able to access professionals on a platform. We have onboarded professionals across more than 8 African countries and counting. Our goal is that by 2030, we would have had at least 40 African countries actively integrated on the platform and have served over 5 million Africans, regardless of the barriers of that distance. That said, I want to also share very quickly about a very important initiative that currently is running. And Dr. Alvin, I know you'll be excited about what I'm about to say now, because aside from doing what we are doing, the VetConnect, VetConnect as a brand, has an initiative called the VetConnect, Champions Program. And the initiative simply is targeting animal health professionals who are studying across universities. So those students who potentially will become veterinary doctors and veterinary paraprofessionals. We are already building a very conscious generation of young professionals or aspiring professionals who a few years from now are going to graduate and become professionals who by then would have been equipped to the right knowledge and how to be able to approach these challenges. In Cameroon, from the University of Boa, we have Vet Konect champions there. In Nigeria, we have across 12 institutions. I think the total number as at our last check is edging into, I think, slightly above 500 now. Graduates across, Nigeria and then the Cameroon. I know Uganda is recently being onboarded. And we want to keep expanding this message across the ends of Africa. And the reason is simple, like I said. Up until when I graduated, I never ever had any opportunity to interact with a colleague from another country like I'm doing now. Today alone, I learned that in Cameroon, a farmer cannot just set up a farm. You have to register it under the veterinary authorities in Cameroon. It's a strong lesson that I would want to see happen even in Nigeria. That is something that is made possible because we're here exchanging these ideas. I hope that tomorrow we're able to address some of these non-tariff barriers around even knowledge exchange and practice, where whether across ECOWAS or SADC or Central Africa, we are able to cross-fertilize ideas, provide relevant consultancy services right here in Nigeria, doing it for somebody in South Africa or in Uganda or whichever part of the continent. That is the future we envision with VetConnect. So I thank you all so much for joining this session tonight. Something has been bettered here. We did the first version in July. August is another success, and we're going to be looking forward to September. And I don't know the next countries that will be coming on board, but I know for sure that the conversation is getting even more interesting and engaging as we go on. But more importantly, let's take away the message that we all have a role to play, no matter how small we might think that role is. It's still important. It's those droplets that cumulatively will turn to something big. Remember that an ocean doesn't become an ocean in itself. It's all of those rivers that all flow into it that gives it the name ocean. It's the same thing we need to do. The efforts across Nigeria, across Cameroon, across Rwanda, Uganda, South Africa, Zimbabwe, all of those are going to come together to become something really powerful. And perhaps we would have sent a very strong message to what is possible and serve as learning points for even other parts of the world. Because remember, our population as Africans is going to keep rising till 2050. The rest of the world is declining. That shows that potentially, and even in reality, we are continuously a beautiful bride in terms of talent needs. So it's something we must embrace and position ourselves so that we do not get handed the short end of the stick. So thank you so much. Thank you, Dr. Abiodun. Thank you so much, Ayo, for being an amazing host. Thank you, dear colleagues, for making time to stay throughout this session. And I look forward to our engagement again in September. Over from me.
Thank you so much, Dr. Teresa, for that. Really insightful. And thank you for the kind of introduction, the motivation, even for us veterinary students, like all VetConnect is doing for veterinary students. It's really inspiring that, as vet students, you get to have first-hand experience. And even when you're outside vet school, you kind of have this confidence because you already have like experience as a vet champion. So thank you for the dream, and thank you to every team member working tirelessly to see that the dream comes to be. And also for the take home, the motivations for every one of us as veterinarians, like we'll hear from Dr. Alvin, from Dr. Nicole, from Dr. Teres, from Dr. David. We need to work together. We need to come together and no longer work in isolation, but work in unity. And so just to share from Toluwalope, who is a vet champion studying at the University of Ibadan, Nigeria. And then his dream of Africa in 2035 is an Africa where we do not have PPR and rabies, where all of this has been eradicated through vaccination. And then he sees an Africa where we have one health, animal health, environmental health that is more improved, where veterinarians, veterinary paraprofessionals are working hand in hand, where we have improved surveillance to protect livestock and serve as a pillar of which is a pillar of food security. He also, believes in continuing education. So, in addition to all we've heard, he's adding continuing education, communication, and sustainable innovation. So, thank you so much, Tolu Lope, for sharing your own sense. Thank you to everyone that actively participated and to everyone that waited up to this very moment. That means a lot because I mean this session would not really be if we do not have you here. So thank you so much. And to our amazing guest, Dr. Alvin from Cameroon, Dr. Nicole from Rwanda. Despite the time zone difference, thank you for making out time to be here to be a guest for this session. Like everything we have heard from you is inspiring and so many take home. Like to see in Cameroon that there is going to be a very good trace back. Every small farm is registered with the veterinary associations, which is very great. And just like last time, what we got to learn a lot from other countries, from Uganda, Kenya, and even Ghana. Like something we get to learn in Kenya is they have bodies, different veterinary bodies that monitor different things, like bodies for small animals, bodies for large animals, bodies for exotic pets, for wild animals. And yes, that's something to take home. And yeah, today this is another thing that we can also take home from Cameroon. And we are so looking forward to another amazing session in September. So before we round up, we'd love to hear some take home, something from our guests, from Dr. Alvin. Is there anything you'd love to share with everyone?
Okay, well, it's been actually a very qualitative session, and I'm really grateful for the opportunity to share and also to listen to other vets from other countries share their own ideas. I would just like to plead that we should make this much more like a habit where we come together, we share, we try to, stand together, stand strong, and make our voices being heard as veterinarians. Thank you.
Thank you so much, Dr. Alvin. Thank you for that. Like we should come together and stand strong. Really good. So, Dr. Nicole, is there something you'd want, to give just a sense to take home?
Hello again. My take home, what I can share with you is that we as we veterinarians, we are the solution. We are the solution. We don't need to wait for others to come and solve our problems, come and help us. We have a broad of things we can do. We just have we're in the field that open have many gates to just go through. So my take home message or what I can advise and everyone here is that we are the solution of ourselves. We are the solution of our problems. Yeah. Once we join hands together, once we put our effort together, we can reach higher, we can reach far from here. Thank you.
Thank you so much, Dr. Nicole, for that. Yes, so as veterinarians, we are the problem, we are the solution to our problems. Like someone said, when you know the problem, it's easy to know the solution. So we are the solution to our problem, and we should work together. Thank you so much, Dr. Nicole. Once again, thank you to everybody for joining. Thank you for your time. And yes, I shared a Gmail on the chat box. So would love to have you together in a common group, Vet Connect, where we have veterinary professionals across Africa in a common group. So in case you're not part of that group and you love to be a part, we would love to have you there. So you can just send an email, send a short email through that email to Dr. Samuel Abiodun, and you would be added. So once again, thank you so much, everybody, for joining. And before we end the call, we just want to have a last roundup closing remarks from the CEO, Dr. Terry.
Okay, I was thinking of giving my last thoughts, but I will just say, let's stay connected. We must continue to build these communities of practice. So I don't know how many Cameroonians are here on the call as professionals. I don't know how many, based on the numbers we have here, I don't know how many are Nigerians. I don't know how many are from Rwanda or from South Africa. But perhaps in our next conversation, we'll put in more energy to see that we drag our own spaces. Every single one of us commands a level of influence. And we cannot solve the problems that we're looking to solve if we do not exert that influence. For some of us as professionals, it might seem as though we are laid back. It's incumbent on us who feel we can do better to remind the other persons to wake them up. For every single transformation that happens in the system, there has to be those early adopters that are eager to jump on what is needed to solve a problem so that the rest can join. So I hope that we'll have a fuller room the next time. And again, I'm excited and looking forward to what the conversation will be in September and who the panelists will be. So thank you so much. And it's been the honor of my life again to be part of this session tonight. Thank you.
Thank you so much, sir. Thank you so much for that. Yes, we're looking forward to September and we're looking forward to the next discussion. And the most important part is looking forward to have you in the next discussion. So thank you once again, and we hope you had a very wonderful time. And in case you missed it or you want to tell your friend who missed it, the recorded session will be shared so you can always go back through this discussion again. And you can always send, you have questions, you have contributions, anything you want to send, you can also send through that email. So thank you once again. Thank you once again to all our guests, Dr. Nicole, Dr. Alvin, thank you, and Dr. Toyota, who could not join us due to some reasons, unforeseen circumstances. Thank you so much for your time. And I hope you have a very lovely evening or lovely afternoon, whatever the time is in your country. And stay well. Bye bye.